Week 1, Part 4, Foot and Ankle. We're going to go ahead and start talking about the arches of the foot. So there are 3 arches in the foot. What are the names of these 3 arches? The medial longitudinal arch, the lateral longitudinal arch, and the transverse tarsal arch. So we can see right here on the lateral aspect, this is going to be our lateral longitudinal arch, the transverse tarsal arch, and on the opposite side, the medial longitudinal arch would be able to be seen. The general primary purpose of these arches is to distribute weight-bearing forces across the foot and to aid in shock absorption. Without these arches, the body weight would be too great for structures to handle. So if we remember in our pelvic region, there's a lot of arch-shaped structures that help to disperse the forces so that our bones are, have the less likelihood of causing destruction in the rest of the body or to other segments. Pretty much helps to spread out the impact that these structures are taking. Without these arches, the body weight would be too great for the structures to handle. Again, so the arches in our foot are supported by a lot of other structures besides just the bones. So we do have the tarsal bones that are interlocking with themselves. We have the tightening of ligaments, especially on the plantar surface of our foot, and then the muscles and tendons that run all throughout the foot also help strengthen that arch and provide support to it. So if we look at a schematic drawing of an arch, this centerpiece is called the keystone, which helps to lock all the other pieces together, and the forces that come straight through are dispersed through other aspects or through the other segments in line with it. So let's go ahead and look at the medial longitudinal arch. The bones that create the medial longitudinal arch are going to be the calcaneus, talus, navicular, the 3 cuneiforms, and the first 3 metatarsals that are corresponding with these cuneiforms. Like I talked about the keystone just a second ago, the keystone of the medial longitudinal arch is considered the talus, or especially the head of the talus. This is because the talus itself has 7 articular surfaces with the bones that it comes in contact with, 3 of which are with the calcaneus. So no matter how the talus moves, it's going to affect the proximal and distal bones as well. So as we have heel strike or initial contact with the calcaneus, it's going to push the talus and cause movement in the other bones, but also remember in our previous picture, this center piece being the keystone, we can see that the head of the talus is pretty much the centerpiece of our arch too, that allows the other bones to move, or it helps to be the center point for the other bones in the foot. All right. Under times of low stress or almost static conditions, this arch is not going to collapse. So if you just glance down at your foot and you're not putting any weight on it, you'll see a slight arch to it in most people. So that's because it's supported by a deep fascia known as a plantar fascia. Of the plantar fascia is known as the plantar aponeurosis, which you can see right here in the middle portion of the foot. And it's from the medial portion of the calcaneus and extends all the way past the MTP joint, so past the metatarsal phalangeal joints. You can see it in the sulcus pretty much right here ending. And the thinner parts are along the lateral and dorsal portions of the foot, so we do have more of this plantar fascia on the other aspects of the foot, but the thickest part again is going to be in this medial portion. And so this is really going to be one of our major supports of the medial longitudinal arch. So if we have a diagnosis of plantar fasciitis, it's the inflammation of the fascia right here. And this is typically going to be the usual site of pain. This diagnosis is often seen in runners or individuals that have a little bit more weight on them, perhaps a female who is pregnant or a patient with who's slightly obese, because they're putting a lot of stress and strain on this plantar fascia. And so typically the pain will be right here. Additionally, excessive, plantar fasciitis can cause exostosis, which is also known as a bone spur or a heel spur. And this is from the abnormal pulling on the calcaneus. Again, Wolff's Law, where little parts of bone are going to grow due to stresses being put on it. Again, here's the site of where the plantar fascia strain would be and where pain would probably occur. So if we look at an MRI on the left picture, you're going to see a normal plantar fascia, which is going to be this very, very bottom portion and some of this black area. And then if we look on the right-hand side, this is an abnormal thickening of the plantar fascia or inflammation of this fascia. Okay, we can also see how the shape of the calcaneus has been altered as well due to this fascia being inflamed. All right, and then, oh, sorry. Again, here is going to be a heel spur, this little bony overgrowth right here that's caused by plantar fasciitis, or sometimes by inflammation of also the Achilles tendon on the posterior side. So in order to see your plantar aponeurosis from a surface anatomy palpation point of view, extend your big toe and you should be able to feel it or see it pop out. So when your toes are in extension, like during push-off and gait, tension is applied to the arch of this foot and assists in push-off by creating a rigid lever that the foot is able to utilize along with the musculature to create a rigid foot. So again, the plantar aponeurosis primarily helps to support the medial longitudinal arch within a passive state, but it also helps to create something you've probably talked about before called the windlass mechanism. Basically, the windlass mechanism allows the foot to go from a supple, shock-absorbing state at initial contact to loading response, and then it transfers the foot into a rigid lever that is necessary for push-off. So this occurs due to the plantar aponeurosis becoming active during walking, and the plantar aponeurosis is causing a shortening in here that increases the shape of the arch and tightens and helps the tarsal bones become interlocked with each other. Now keep in mind that other structures also support the medial longitudinal arch and help with the windlass mechanism, but especially with the plantar aponeurosis, know that its length is going to be from about here, and it's going to come and cross over the MTJ joint, and it's going to become shortened and creating this arch structure. All right, so again, because the aponeurosis extends beyond this, when the first toe is dorsiflexed during walking, the aponeurosis, because of it being wrapped around, helps to pull the calcaneus up and bring the tarsal bones in a locked, rigid position. In this position, the arch is increased but also more stable. So take a look at page 315 in the Atlas of Orthoses and Assistive Devices, and hopefully that will give you a little bit better explanation of how the foot goes from a supple, rigid foot to a supple foot to a more rigid foot. Okay. Let's move on to the lateral longitudinal arch seen on the left right here. The lateral longitudinal arch of the foot is created again by the calcaneus, but also the cuboid and the fourth and fifth metatarsals. The plantar fascia, like we talked about earlier, is weaker in this area, but it still helps to statically support the arch. The medial longitudinal arch is going to be higher, however, than the lateral longitudinal arch. With it being higher, it allows for more shock absorption, which is good because the center of mass on our bodies is directed more so through the medial portion of the foot. Now for the lateral longitudinal arch, the cuboid is going to be the keystone because it is the main supportive structure and receives push from the calcaneus and drives those metatarsals and phalanges. All right, and now our last arch, the transverse arch, is made up of the navicular, cuneiforms, cuboid, and metatarsal bones, and helps to disperse some of the weight from the medial side of the foot to the lateral side. So this is a cross-section of the transverse arch, and you can see how the cuneiform bones and the cuboid are going to make this arch-shaped structure this way that helps to pull from the medial to lateral and helps distribute that weight again. Alright, we're going to talk about just the distal tibia and fibula really quickly because I'm going to move on to ligaments of the foot and ankle next, and you can't really talk about the foot and ankle without talking about the distal portion of the tibia and fibula. So I'm not quite sure in your anatomy class, but hopefully we talked about, or you guys learned, that the ankle joint is a mortise or a mortise, however you want to say it, type of structure. So in carpentry, it's pretty much like this sort of layout. So when I show you the next picture, think of this portion being the tibia and fibula, and then this being the talus that kind of fits into that block or in this portion, okay? So let's go ahead and take a quick look at that. So, all right, let's zoom in on here. All right, again, so here is going to be our tibia. This is going to be our fibula. The tibia is going to come around anteriorly and cover a large majority of the talus. And then we need to pay special attention to the medial malleolus right here. And then when we look at the fibula, the lateral malleolus, these are going to help lock in the talus in this mortise joint. Okay, they just create this lock, and so you can see the tibia locks around the fibula and helps to hold it in, and it pretty much creates that square shape, kind of like a key in a keyhole, right? So we will talk more in detail about how the tibia and fibula articulate over the talus when walking and during locomotion, and how the width of this joint is able to change. So remember when I talked about the anterior or the more distal portion of the talus being wider when we looked at it from an aerial view, the format of the tibia and fibula are able to accommodate, and the joint type is able to accommodate this thickness as it moves more anteriorly towards the talus. So just keep that in mind. We'll talk about it a little bit more later, but the size of this joint is able to move and expand and then decrease as it moves over the talus. All right.